And I need you to write this date down. That is October the 28th. It is National Take Back Day. And what are they taking back? Well, we're going to tell you all about that coming up with our guests. We got Abby Winstead. She's with the Mississippi Public Health Institute, and Dominic DeLeo. He is with the Mississippi Department of Health. And you guys are taking back their unneeded prescriptions. You're not taking back their children or taking back their favorite shoes or anything like that. But this is for a good thing. So welcome. Glad to have y'all here. Okay, Abby, let's start with you. When we hear National Take Back Day, and this is a good thing. So what is happening on October the 28th?
Twice every year, the DEA hosts this National Drug Take Back Day. And what that really means is clean out your medicine cabinets. We want to get all the excess out, really just to reduce risk for your family. And so we're trying to spread the word that that's what's happening because it's a good thing if you'll clean out your medicine cabinets. It is a good thing, and I think more people need to hear that this is an opportunity. I guarantee somebody's listening to good things, and the moment you said that, they go, yeah, and there's something that's been lingering. Because, Dominic, you get sometimes these prescriptions, you don't use them all, or they go out of date, and you're like, I don't know what to do with them. So now there's something good to do with them. So how long, or I guess about how long, has the Take Back program been going on?
I think nationally and Abby can correct me if she knows better, but I think nationally it's been about 10 years. And we've been involved, when I say we, meaning Department of Health and MSPHI, I think 4 years.
Yeah, that's right.
And they realize there's obviously a problem, that to give people a safe and convenient place to sort of do this. So what was the build up for this to sort of take place?
I would say it's kind of two-pronged. One is anytime you've got medication like that that's still in a medicine cabinet, access to anybody that shouldn't have it is there. And that can mean anybody from your teenagers in your house that are at home and bored and can experiment with things, or it can mean repairmen that come in. If you've got an open house for real estate, there's all kinds of markets that people will come in and they'll kind of peruse in your medicine cabinets.
Yeah.
And you may not miss one or two at a time. So you may not notice that they're going missing. And it a lot of times is obviously totally accidental that people start to develop addictions to things like this, just one or two pills at a time. So this is a way that you can kind of eliminate that risk for your family. You can be proactive with this. And the other reason is really just, in the past, people have flushed it, people have put it down the sink, put it in the garbage, and this is a way that you can avoid doing all of those things. That's free, it's convenient to do. Twice a year, dump them all out and just be done with it.
So, Dominic, because I think about it, we flush our goldfish, the dead ones, not the alive ones, down the toilet. And maybe that's not the best way to dispose of a past pet either. But when you think, well, why can't I just flush them down the toilet or down the sink or throw them away? At least disposing of them. They're not in my cabinet anymore. Why is that also not the best idea?
Well, I think we have to, I'm not a meteorologist, but I think we have to remember it all kind of works together. So when we flush it down the toilet, it does go into our wastewater systems, and most stuff gets clean, but some of that, the chemical or some of what's in the drugs, stays in the water. So we just recently did some focus groups, and it was interesting that I was surprised how many people knew that they should do something with the prescription drugs that they have rather than just hold on to them forever. Most of them didn't know there were locations that would take them back, and when they did something with them, they were flushing them. They were admitting that they were flushing them down the toilet.
Because you feel like that was just, and here's how it goes. You think, well, my little few pills is not going to contaminate, the water system or be the issue. And you're right, yours isn't, but yours compounded with everybody else who's doing it in the neighborhood or within the water supply. Now we have a bigger issue because, Abby, you've got some incredible numbers, at least nationwide. The last take back, or I guess you tell us what the numbers stand for, how many pounds of prescription drugs are being brought back?
Yeah, so they have a incredible turnout every year. It's more than you think would really be happening. So they do it twice a year, every April and October. And so we're coming up on this one. But this time last year, nationally, there were 324 tons of medication brought back. In the state of Mississippi by itself, there are about 2 tons. That's a huge number. And then even in April, there were an additional 2 tons in Mississippi brought back. So within 1 year's time, 4 tons of medication just in the state of Mississippi were brought back.
And not that everybody was going to flush that as their alternative route, but you can imagine if you had, now we've got a problem. Like now that's an issue within your water supply, and you just don't want to be part of the problem. You want to be part of the solution.
Right.
And part of the solution is just knowing that these 2 dates happen every year, and then where to take them when it comes up. And the date we want you to remember is the October the 28th. So that's actually this coming up Saturday. And so you have nearly 100 locations across the state. Is there one in all 82 counties or within close spitting distance, as they would say?
Yeah, spitting distance is the hope. These are dictated by the DEA that comes, and they will set up sites all throughout the state of Mississippi. They are ideally within spitting distance, yes. There's a site that you can go to and enter your zip code. It'll pop right up on what the closest site for you is. And I'll put a plug in that there are also sites that are open year-round.
Oh, good. Okay.
So this is not something that you have to save up for 6 months and then you can do it again. There are sites on odfree.org, actually, which we'll talk more about, I'm sure. There's sites readily available. There's a link you can put your zip code in, and there's a list that'll show you what sites are available all year round, both law enforcement and not.
Dominic, someone's asking on our text line, what ends up happening with the 4 tons of prescription medication that comes in? Because it's like, well, if we can't dispose of it that way, then obviously it's the same thing with like computer, cell phones, and all of that. What do they do with it? Like what happens to it next?
Guess I'm getting all the hard questions.
Oh, I'm sorry.
I actually do not know the answer, but I will make myself a note. I think they're destroyed, but and you know, we're talking about prescription drugs. What we're really concerned about are opioids. So
because they all go in the same bucket. Like it's not like recycle bins where they start to pick apart and then, you know, this is all going in one big bin and then being taken somewhere. My guess would be also that they would be appropriately destroyed, however that looks like, however else they do other type of things that they just sort of get rid of. I can't imagine there being any recycling program.
No.
For
the
prescription
DEA
drugs.
has all the people that know all of those things, and so I hope and trust that that's what's happening as they take them back there.
But really, it's like, you know, once it's, this sounds terrible, but once you've done your civic duty of disposing of them the proper way, and then, you know, it's like, okay, I can rest easy that I didn't put them in a trash can or put them in, you know, down the toilet or put them down the sink or whatever. I did my part. So, you know, here, you know, tag, you're it. You do,
Right.
You do your part sort of with that. You mentioned the odfree.com. What other resources are there?
You take that one, Dominic.
And I hate to correct you, odfree.org.
.org. Yep, that's important. Thank you.
Because we don't want people to miss that. It's really the go-to in terms of opioids in Mississippi. It's the go-to website. Everything from you can request a naloxone kit, and that's one of the things maybe we'll talk about during our conversation here. You can obviously find any one of these sites where you can take back prescriptions. There's information about where to find treatment. Abby, am I forgetting anything?
I think you hit the high points.
When you bring it on Saturday to one of the 100-ish locations, do you just bring it in the Madison bag, or do you already have to put it in like its own little zip top bag, or can you bring it in the bottles? Do you need a proof of prescription? Any of that? Maybe, you know, you're wanting to dispose of a past loved one's. It's no questions asked if you want to get rid of it.
Yeah.
No questions asked. Bring it as it is. Yeah. They'll tell you exactly what they want you to do with it when you get there.
And I mean, I would think if people are concerned about putting their personal information, because your name would be on the little bottle,
dump the bottle and then
they could just
do it that way. Even expired aspirin.
Anything and everything, they'll take it.
Anything
and everything, they will take it. Y'all have got some other great programs coming up, and we'll talk about that coming up next. And if you want to find a location that will take back your prescription drugs coming up this Saturday, October the 28th, for National Take Back Day, then you can go to odfree.org. Correct, guys? Put in your zip code and find a location near you. Now, that's not all the good stuff you guys are up to. I know other things within your programs is giving out or distributing naloxone, am I saying that correctly? Yes. At no cost. Okay. Is it okay, Dominic, if I give you that question? What is naloxone?
It's perfectly fine. That's an easy question.
Good deal.
Any individual can go on the OD Free website, and there's a naloxone tab. They can go to the naloxone tab and fill out a request form, and we will ship it. The pharmacy department at Mississippi Department of Health does all this. They will ship it to you with no other
So for those that have heard the name but maybe aren't familiar what it is, what is it?
Naloxone? Mm-hmm. Sometimes people call it Narcan, which is sort of a brand name. There's another one that we ship called Cloxato, so those are two brand names for naloxone. And it essentially stops the overdose for about an hour. So if you had a naloxone dose and you were giving it to someone, you still need to do
get them somewhere.
All the other things. You still need to call 911. You still need to get them to a hospital. Hopefully you're not the only person there. Someone's already called 911, either law enforcement or a first responder. EMS is there. Mississippi also has a Good Samaritan law, so if you're doing that, you can't get in any trouble for it legally.
And I think these are good things we need to make sure. I mean, everyone should know them, but also our kids, specifically those with, in the college age or high school age, that maybe we're not making the best life choices or hanging around with the people who are still, living wild and fancy free, and that you won't get in trouble, and that these things are out there. Because I know this particular law was passed as a proactive tool to sort of help buy time, and the idea is buying time for that individual to then hopefully get the help that they need, so this never happens again. Or if it's a first-time overdose because they were at a party, made a poor choice, and then they get the opportunity to live past that one mistake. So it's not a opportunity to just do whatever the heck you want and then be able to reverse it, what some folks have a mindset of.
And we're always really careful about talking about reversal, because after that hour, the effect of the naloxone will wear off.
So you've got to get help.
And especially if you've taken a large dose,
it buys you time.
Yeah. So and then you can obviously administer another dose, but you have to get somewhere else. You have to get to a hospital. You have to get other help. So, yeah, we don't like to use that word reversal.
Correct.
It will reverse it for a short amount of time, but not for very long.
Not for very long in that way.
Yeah. There's also other ways, and other than just individuals. I don't know if Abby wants to talk about that. She's probably
I can. We have a variety of programs that we all kind of partner interagency and nonprofits and government agencies. This is obviously something that Mississippi is taking seriously, and we're making progress, but a lot of our other programs have coordination effects. Really, we've got efforts across the state that are happening, and that's everything from raising awareness, stigma reduction, and then this naloxone distribution, and that's getting it into the hands of law enforcement, because they're the ones that are often coming into contact with it. So sometimes it's them utilizing it on each other. And so it's also saving law enforcement lives. It's distributing.
Because if you come in contact with certain things, you can get effects with it.
They can overdose just by
working
their proxy.
Yes.
Yeah. So obviously we like to keep them in ample supply of naloxone. We're also distributing to school nurses in the K through 12 schools. Hopefully that will be expanding in the future as we get more and more in the hands of people. Higher education programming is going, so we're trying to get as much on college campuses as we can, because we're seeing a lot of it, and we're seeing that laced with a lot of other things that are quickly causing overdoses. And then the general public, like Dominic was talking about, we can do through OD Free. So there's a lot of programming. It's out there.
So the concerned parent or caregiver who's listening, who may have someone at home that's just wrestling or struggling, they can go to odfree.org and have it shipped to their house, or at least maybe they sleep better, or they know they have an opportunity to help, and they don't have to go through hoops of getting past judgment or any of that. It's something they can take into their help, which I think is a good thing.
And if I might, that is not the only way. They can also go to a pharmacy, and there's a standing prescription order through the Department of Health and the Board of Pharmacy, and they can say, I would like to get a prescription, for naloxone, or I would like to get some naloxone, and they would take your information. If you have health insurance, they would take all that information, and they would be able to dispense it there. So you don't only have to go through our request form that's online. For most people, that's the easiest way. And it's also kind of anonymous.
Right. And just knowing that it's available and that you would rather have it than not have it. And if you feel like, oh, that's something I feel like I need, then you probably need it. If you're like others who are like, oh my God, why would anybody have that? Then that's not for you. And that's okay. Like, move on. And consider yourself lucky, because it could be at some point with a loved one. You just never know. Another key piece to what you guys do is getting the community started with better communication. So tell me about the town hall meeting sort of concepts that you guys got going on.
That's something we've done some in the past, and I think we're looking in the next year or two to do a lot more outreach into the community. Again, on our website, there's a request form. If people, whether it's a church group or a school district or a school or any group that wanted us to come, they can put a request in. We can tailor it, depending on who the group is. And we have I'd say it's about a half-hour presentation, and then we'd have folks there to answer questions.
Do you feel like the conversation is being welcomed and started more, Abby, since, I don't know how long you've worked in this position, but since this has been going on, do you feel like more people are open to having the conversation?
I think we're definitely making progress. It's still something that a lot of people don't like to talk about. Addiction itself is very stigmatized, and so we do a lot of work with stigma reduction because a lot of people are more willing to get help if they're not approached in a way that feels attacked. So we do a lot of work there, yes. But with the reception of these kind of conversations happening, we're seeing large improvements in people at least being willing to have the conversations at this point. Which we count as a win, because when I've been in this position about 4 years, and it's been a drastic change in just that 4-year period. Now, sadly, that's because it's becoming more frequent, and people are realizing that this is something we have to talk about at this point. It's not as much preventive at this point as it is we're just responding to a need. So the hope is that eventually it will be preventative again. But at this point, it's just being reactive to the need that's in the state.
It can definitely feel like you're drinking from a water hose whenever you're trying to talk about drug reduction or overdose, stopping overdose. But what I'm hearing from you guys, and then from others that we've had our own good things, is that Mississippi's not doing nothing. Right? Like, there's a lot that's out there. There's a lot of programs. You just may not be aware of them, which is why we were talking about your own good things. And then that's not the only piece. Everyone has to play an active part in that. So for the average person listening who's not struggling at the moment in active addiction, or maybe they don't live with someone or have someone close, how are you part of the equation of helping keep Mississippi OD free? A tough question, Dominic.
That's for me.
For both of you.
Yeah, I mean, obviously, I think we're all, we're all part of this. Whether you know someone who has a substance use disorder, or you're just like, I like to think. I was going to add before, I'm someone who has drug allergies, and I have a EpiPen, and I sort of think of naloxone as everyone should have naloxone, just like most people should have an EpiPen, because you never know when you're going to be around someone that happens to. But I also think just being aware of what's going on in your community and being able to be a source, an educational source for other people. I know, people get very scared of fentanyl because they've read many horror stories about, fentanyl and what it does to people, and if you're even just in the general vicinity of fentanyl, how it can affect you. And that's one of the things we do, is we try and educate people about that, and hopefully they'll educate others. We're not going to reach everybody.
Just keep shouting it from the rooftop. Don't take pills from strangers. Like, if it don't have your name on it, don't take it. That's pretty much like bottom line. You'd think it would be that simple, but it's not. But if people still have questions, Abby, or if they want to learn more about the Take Back coming up this Saturday, where do they go to get all their information?
They can either go to the DEA has a Take Back site specifically up for these days, so dea.gov, and it'll take you right to it, or odfree.org will have some information that will link them to that also. But if you've got specific questions that you can't find answered, I'll throw my email out there and I'll get you to the right person. It's Winstead, AWINSTEAD @msphi.org.
All righty. Thank you both for your time and what y'all are doing. See y'all back in the spring, right, for the next one.
We'll be here.
All right, y'all stick with us. We got more for you coming up next.